1. What is the most common cause of congenital esotropia? A. Cranial nerve 6 palsy. B. Refractive error. C. Sensory deprivation. D. Unknown etiology. 2. The primary purpose of a prism cover test is to A. Determine refractive error. B. Diagnose amblyopia. C. Measure the angle of deviation. D. Assess convergence. 3. Which of the following is not typically a feature of Duane syndrome? A. Globe retraction. B. Limited abduction. C. Ptosis. D. Narrowing of the palpebral fissure. 4. Amblyopia is best defined as A. A misalignment of the eyes. B. A neurological deficit due to trauma. C. Decreased visual acuity not correctable by refractive means and without detectable pathology. D. A cataract-induced visual impairment. 5. Which condition is characterized by a vertical deviation that changes with head tilt? A. Brown syndrome. B. Superior oblique palsy. C. Duane syndrome. D. Internuclear ophthalmoplegia. 6. What is the expected result in the cover-uncover test for a latent deviation? A. Movement of the uncovered eye. B. No movement in either eye. C. Movement of the covered eye upon uncovering. D. Movement of both eyes simultaneously. 7. Which muscle is most likely underacting in a patient with a right hypertropia that worsens in left gaze and right head tilt? A. Right inferior rectus. B. Left superior oblique. C. Right superior oblique. D. Left inferior oblique. 8. The 4-diopter base-out prism test is used to detect A. Strabismus. B. Convergence insufficiency. C. Suppression. D. Diplopia. 9. Which cranial nerve is affected in internuclear ophthalmoplegia? A. Cranial nerve 3. B. Cranial nerve 4. C. Cranial nerve 6. D. Medial longitudinal fasciculus, not a cranial nerve. 10. What is the term for an alternating hyperphoria with a right hyperphoria in left gaze and left hyperphoria in right gaze? A. Dissociated vertical deviation. B. Comitant vertical deviation. C. Oblique muscle dysfunction. D. Pattern deviation. 11. The force duction test primarily assesses A. Neurological control of eye movement. B. Sensory fusion. C. Mechanical restriction of the globe. D. Visual acuity. 12. Worth 4. Test assesses A. Visual acuity. B. Stereopsis. C. Suppression and fusion. D. Muscle strength. 13. Which condition is most often associated with a V-pattern strabismus? A. Inferior oblique overaction. B. Superior oblique palsy. C. Convergence insufficiency. D. Sixth nerve palsy. 14. A prism placed with the apex toward the deviation will A. Increase the angle of deviation. B. Eliminate diplopia. C. Shift the image toward the apex. D. Provide optical magnification. 15. The Hess chart is primarily used to A. Evaluate refractive error. B. Map field loss. C. Assess ocular misalignment in paretic strabismus. D. Measure intraocular pressure. 16. The most effective age range for amblyopia therapy is A. Birth to 1 year. B. 3 to 7 years. C. 10 to 12 years. D. 15 to 18 years. 17. Which test is best to evaluate binocular vision? A. Snellen chart. B. Worth 4 dot. C. Cover test. D. Maddox rod. 18. What does a positive Bielszowski head tilt test indicate? A. Cranial nerve 3 palsy. B. Cranial nerve 6 palsy. C. Cranial nerve 4 palsy. D. Convergence excess. 19. The measurement of deviation that varies in different gaze directions is referred to as A. Comitant deviation. B. Non-comitant deviation. C. Phoria. D. Fixation disparity. 20. What is the purpose of synoptophore testing? A. Measuring intraocular pressure. B. Evaluating fusional amplitudes and retinal correspondence. C. Assessing near vision. D. Screening color vision. 21. Double Maddox rod test is used to evaluate A. Cyclotropia. B. Accommodative amplitude. C. Saccadic movements. D. Pupil reactivity. 22. The most common form of accommodative esotropia is A. Partially accommodative. B. Fully accommodative. C. Non-accommodative. D. Convergence excess. 23. Hirschberg test estimates A. Refractive error. B. Pupil size. C. Angle of deviation using corneal light reflex. D. Visual acuity. 24. Which is a characteristic feature of Brown syndrome? A. Superior oblique palsy. B. Limited elevation and adduction. C. Globe retraction. D. Inability to depress the eye. 25. Stereoacuity is measured in A. Diopters. B. Arc seconds. C. Degrees. D. Prism diopters. American Orthoptic Council. The American Orthoptic Council AOC test is a rigorous certification examination designed to evaluate the knowledge and clinical skills of individuals pursuing a career as a certified orthoptist. Administered by the AOC, the test assesses proficiency in diagnosing and managing disorders of eye movements and binocular vision, including strabismus, amblyopia, and neuro-ophthalmologic conditions. Candidates are expected to demonstrate expertise in performing orthoptic evaluations, using diagnostic tools such as cover tests, synoptophore assessments, and prism measurements, as well as developing non-surgical treatment plans. The exam includes both written and practical components to ensure that certified orthoptists meet the highest standards of clinical competence and ethical practice. Here are the top 5 beneficial uses of the sample exam. 1. Professional certification. The AOC test provides formal recognition of clinical competence, allowing orthoptists to become board certified and gain credibility in the field of eye care. 2. Career advancement. Passing the AOC test opens doors to a wider range of employment opportunities in hospitals, private practices, and academic settings, often leading to higher salary potential and job security. 3. Standardized knowledge base. The exam ensures that certified orthoptists possess a consistent and comprehensive understanding of ocular motility disorders, binocular vision, and non-surgical management, which enhances patient care quality. 4. Interdisciplinary collaboration. Certification fosters trust among ophthalmologists and other healthcare providers, promoting effective team-based care. 5. Continuing education and growth. Maintaining certification encourages ongoing learning and professional development, keeping orthoptists updated with evolving best practices and technologies in vision science.